Hey, it's Dr. Gary Cowell of Mobile Physical Therapy, and I've recently released the 5 signs that you're running with a problem that can easily be fixed with physical therapy. Each week, we'll be going over one of the signs as well as a few other things in greater detail. So this week, we'll be going over sign number 4, that you're running with a problem that can easily be fixed with physical therapy, as well as 2 more running deviations that often result in injury. Sign number 4, that you're running with a problem that can easily be fixed with physical therapy, is you have hip pain, knee pain, low back pain with negotiating stairs, or after prolonged sitting. Many runners, especially those who are parents, have these complaints. They say they have difficulty picking up their child. Their knee, low back hurts when going up or down stairs. They say I have pain in my knees when I try to get up from sitting for long periods of time. And these issues are also related to limitations that you may have while running. When we fix these symptoms, or when you fix these symptoms, they often translate into improvements in your ability to run as well. So today we'll be going over 2 more running deviations, which are the leaner and the overstrider. The leaner is someone who leans back or is very upright with very little forward lean angle. This deviation is often associated with weakness of the gluteus maximus muscles. And these individuals often have increased strain on the quadriceps, the hamstrings, the patellofemoral joint, as well as their lower back. And because of this upright posture, when they initially strike the ground, it places a lot of stress on the quadriceps, and in this case in particular, the patella and the patellar tendon. So now we'll talk about the overstrider. The overstrider has increased stress at the patellofemoral joint, at the patellar tendon, as well as the hamstrings. The areas of complaint are similar to that of the leaner. The difference between them is that the leaner's upright posture tends to move their center of mass posteriorly, causing an increased stress in their brachial musculature, while the overstrider contacts the ground too far forward of their center of mass, which places excessive stress on their brachial musculature. So as you may see right now, the things that these two things have in common is that the stress is increased on the brachial musculature, the knees as well as kneecaps. So if you notice that after going on a run, you're having difficulty getting up out of your chair later on that evening, or if you find that stairs are now painful, you may have an issue with one of these running deviations. So to conclude, we went over sign number 4, that you're running with a problem that can easily be fixed with physical therapy, which is you're having pain in your knee, your hip, or low back when negotiating stairs, after prolonged sitting, or when bending down to play or care for your children. We also went over 2 running deviations, the leaner and the strider, and also the commonalities associated with both those running deviations. We went over why you often have knee pain with these running deviations. And next week, we'll go over sign number 5, that you're a runner with a problem that can easily be fixed with physical therapy, as well as go over some misconceptions and 5 mistakes that people make when returning to running. So if you're struggling with any of these issues, or if you want to return to running, we're offering a total body runner optimization assessment. This is a 20-minute consultation where you get to sit down with a board-certified orthopedic physical therapist, discover the mobility and strength limitations resulting in your pain, and learn exactly what you need to do to fix them. So if you have any of these issues, just drop a run again in the comments below, or you can even click the link in the description. I'll see you next week, and be well.